Good morning. I am Dr. Nithya, Assistant Professor in the Department of Obstetrics and Gynecology at Sri Lakshminarayan Institute of Medical Sciences. So today we will be dealing with one of the important qualities that a medical student or a doctor in his career should possess, that is leadership qualities. So we know that leadership is important in any field of work, but the importance of leadership in medical field is being recognized lately. So it has been decided to include the same as a part of curriculum formally. So today we'll try to have an introduction about leadership qualities, how to develop them, and what are the qualities of a good leader, and what are the challenges you will be facing when you're holding a leadership, and also the types of leadership that you will come across in your career. So let's go into the topic. So we know that the NMC has a broad goal. The goal is to create an Indian medical graduate possessing knowledge, skills, attitudes, values, and responsiveness that he or she can function appropriately and effectively as a doctor of first contact in the community. So the main goal of this medical education is to create an effective Indian medical graduate with all those qualities that are mentioned here. So to possess these qualities and competencies, a medical student or an Indian medical graduate should perform all these roles. These roles include being a clinician. So being a clinician means having the skills and knowledge that is needed to perform both curative and preventive roles, and also that will help in diagnosing the conditions, all these things. And also, second, he should act as a leader and member of the healthcare team and system that we are going to see in detail in this presentation. Also, he needs to act as a good communicator. So communication doesn't mean only to the patient, it also means how we interact with the attender, how we break a bad news to them, or how you explain the options of treatment that are available, and also about the inter-communication that we have among the colleagues with your seniors and the team, basically. So communication skills matter a lot when you're holding a leadership. Not just leadership for every Indian medical graduate, it is important. Fourth one is a lifelong learner. So you know that medical education is not one-time learning. You need to be continuously upgraded with what is happening in your field of medicine. So the knowledge and skills have to be updated every day, now and then. Okay. Finally, we need to be very, very professional, which includes being ethical, empathetic, etc. So a good Indian medical graduate should possess all these roles. So according to the NMC, these are the important points that are mentioned under the leadership or being a member of the healthcare team and the system. So a leader should work effectively and appropriately with his colleagues in an interprofessional healthcare team, respecting the diversity of roles, responsibilities, and competencies of other professionals. Recognize and function effectively, responsibly, and appropriately as a healthcare team leader in a primary and secondary healthcare setting. So in a primary or secondary healthcare setting where you don't expect everyone to know everything, a person who is actually acting as a team leader should get the things organized. For example, if we are planning to organize a camp in a village, then again you being the doctor will be the team leader. Though you have many other people to support you, like staff or a technician or a medical social worker. So they all have to be told the roles and responsibilities by you. So you have to recognize and function effectively in that setting. Educate and motivate other members of the team, and work in a collaborative and collegial fashion that will help maximize the healthcare delivery potential of the team. So it's basically encouraging each and every member of the team to bring the best out of them. Next, access and utilize the components of healthcare system and health delivery in a manner that is appropriate, cost-effective, fair, and in compliance with the national healthcare priorities and policies, as well as be able to collect, analyze, and utilize the health data. So this is also important from statistics point of view, and you have to make sure that the treatment that you're going to give is cost-effective for the nation, and it has to be delivered in a more appropriate way. Participate appropriately and effectively in measures that will advance the quality of healthcare and patient safety within the healthcare system. And also recognize and advocate the health promotion, disease prevention, and healthcare quality improvement through prevention and early recognition. So as I told you, being a clinician, you always have to be both preventive and curative. So there are diseases which can be identified early. There are diseases which can be prevented. So all these have to be done by the leader. Of course, in collaboration with other members of the team. Okay, moving on to leadership. Leadership is complex, but it is highly valued component of health education. It's an influential process where a group of people work towards achievement of a common goal. Incorporation of leadership development and training as a part of professional curriculum is being stressed a lot because it is a must possess competency. So it cannot be like one among the 100 will have the leadership quality. It is 100 out of 100 should have the leadership qualities, and we should make efforts for each of the Indian medical graduate to learn the develop the leadership qualities that is already existing within them. So why do we think it is essential for everybody to know it? So as I told you, it is necessary for delivery of high standard of education, also in a clinical practice and also in a scientific research. So in all these fields, a leader is definitely essential. So how different is a leadership in healthcare from other fields? So we also know that it should not rely on formal position of authority. It should basically utilize one's own leadership qualities, irrespective of the level within the organization. So for example, the HOD in the department need not be doing it always. So each and everybody has to be contributing. So it is always different from other departments because it is not the head always. It's not based on the position of your authority or the level, hierarchical level where you stand in the organization. It totally depends upon your own qualities and how you develop them. So here you need to understand between difference of two terms, management and leadership. Both are equally important in achieving organizational goals. One produces, that is management, produces order and consistency. It is more dealing with the, I'll explain the differences much better in the next slide. Leadership produces change and movement. So this is something positive that is influential, and also you are involving others in leadership. Whereas management is something like unidirectional, where you're forcing something but getting the work done. So this will clarify the differences. Management basically deals with plan and budget. That is, when you're planning a project, the resource allocation and the time management, setting up the agendas, all these are done by the management. Whereas leadership basically establishes a direction. So it deals with shared vision, identifies the bigger picture in the future. It sets up small goals and strategies to achieve those goals. And management is basically employment and organization, where somebody maintains a structure, staffing placement, and enforces the rules. Whereas leadership is all about connecting the people, that is communication between each other, how to build a team, and how to make the network very strong when you're dealing with the team. And third one, management mainly deals with problems. So when you have a control, you can have a problem solving attitude as well. So they usually deal with reward systems. When they identify a problem, they take, they try to solve it and take corrective actions. It could be rewards, it could be positive reinforcements. Sometimes there could be even negative reinforcements. Whereas in a leadership, it is always the goal is to motivate and drive. So you be inspirational as a leader and you try to motivate other members of your team, empower your followers when everybody is working towards the needs. So there are many different types of leaderships and many models of leaderships have been identified. I have taken the one which is very familiar. So here we basically classify leadership into two types, that is transactional and transformational. So transactional is something where you hold the individuals very responsible. So it is more of an authoritative leadership that is based on transaction. They value the order and structure, and they have formal authority in the organization. Usually, they achieve all the goals through rewards and positive reinforcement. So here, it is more like based on one's own authority. What is the disadvantage in this type of leadership? Here, there is a lack of innovation. So individuals are driven only by predetermined outcome. You are set to do this, then you will do only this. So you will not be motivated to do what is more than what is expected from you. So that lack of incentive and motivation to perform more than what is expected, you only meet certain predetermined set goals. That is a disadvantage in case of transactional leadership. The other or a more favorable type of a leadership is transformational leadership, where it is more of a process of influencing the individuals to work towards a common goal. So it's based on basically inspiring each and every one of the team and also forming the team to achieve the goal. It defines the organizations through articulation of a clear vision and a clear value. So this is more of a freedom than more of authority. So transformational leadership can be best described by 4 I's. So the first I will be idealistic influence. That is, pride, respect, and trust is stimulated through the development of a vision. So you have a vision for the team towards which everybody in the team works for. Inspirational motivation, that is, high expectations are created through role modeling. So the leader, instead of ordering something, he just he is a role model for others to follow him. Individualized consideration, that is, respect and responsibility is fostered through personal attention to the followers. Intellectual stimulation, that is, new ideas and approaches are used to challenge the followers. So there you don't give predetermined outcomes, you only challenge them with everyday new approaches. So there is something, these are the two broad classifications of leadership, that is transactional and transformational. To sum up, transactional is authoritative based and predetermined outcomes, whereas transformational is more of motivating and inspiring the team members to do something more innovative. Okay. So here, there's something called team leadership, which is coming up, where there is a collaborative role, shared leadership, and thoughtful allocation of responsibility. So here, there's not one leader, but there are 2 to 3 people who share the leadership, and they also have different responsibilities. Here, the team members are interdependent, coordinate their activities in order to accomplish their shared goals. Here, personal autonomy, accountability, appropriate recognition, and clarity of roles contribute to the optimal team performance. So, all these are important qualities of the team members. So, in general, according to the American Association, there are different qualities of a leader that are described. That is, a good leader should possess these qualities: knowledge seeking, adaptable, ethical, good time management, He should be visionary or introspective. So whenever somebody gives a feedback, he shouldn't be offended. They should readily accept that feedback and try to modify their actions according to the feedback. They should also have a self-awareness. And the most important thing for a leader to have is excellent communication skills. So whatever communicated, if not done in the right way, will not make sense. So that is very important. Even the language has to be very, very clear and stimulant. And most important thing is to pay attention to the team members. That is active listening. So when there is a problem, you have to actively listen and try to sort out. Team dynamics is again very important, and also a leader should be able to create opportunities for the other team members to come up. Describing in detail the qualities of a leader. Knowledge of leadership concepts is very important. This includes theoretical background, organizational structure, and leadership development of others. Second, motivator, mentor, and a facilitator. Integrity should be shown in motivating and encouraging others instead of controlling the situations. Through excellence in role modeling and careful delegation, future leaders are developed and succession planning can occur. Third, a leader should be a good communicator, as I told you before. Good communication entails consistent messages through various methods over time. Communication by leaders is required at all levels to senior management, administrators, team members, and also to the patients and their attenders. Communication should always be respectful and acknowledge the input and achievement of others. Networking, facilitating groups, effective listening, and feedback skills are important. Ability to set direction and lead a change. So a leader should understand the environment well and then set the goals, change the management whenever needed, and also should actively be involved in decision making. Leadership presence, the ability to assume a leadership role in various settings, share your opinion with confidence, and communicate and engage with others. These are all important when you are working as a leader of the team. So a good leader is not only a leader, but also a team player who values and seeks the opinion of the others. So he should be actively involved like others in achieving the goal of the team. Leaders are also involved in teaching, coaching, and mentoring, holding the team members accountable and undertaking performance appraisals. Conflict resolution skills are needed in leadership roles. The views and abilities of all the parties should be respected. Group problem solving, conflict management, contributions to team process and development. Business skills are also essential. Human resource management, workflow budget, effectiveness evaluation, business plan development, reduction of waste and insufficiencies. Financial management skills for resource allocation, reduction in variation of clinical practice to reduce the costs. All these skills are also important when you're taking care of a project. Self-management, that is time management and the work-life balance. Ability to develop others, that is creating opportunities for the others in the team, also equally matters. Okay. What are the various challenges that you face when you're acting as a leader? So mainly there are 4 issues. First, personal issues. It can be difficult to maintain an appropriate work-life balance, particularly for those with family responsibilities. And also managing both clinical and academic career is very, very difficult. We all know that when we become clinicians and get busy, we most of the times forget to update our academics, especially those related to medical education, which is very much lagging. Organizational and cultural issues. In order to succeed, leaders need to understand the culture of their own organization. So suddenly when you go and work in a new setup, you cannot set your own new rules and change everything. So you have to go with the flow of the organization and try to implement the changes very slowly. Some healthcare disciples may better facilitate demands of both academic and clinical life. Balancing the competing agendas, dual demands of the higher education sector, which is highly accountable, and healthcare systems with rapid change may be very stressful for the healthcare education leaders. The wider agenda. Education leaders need to have an awareness of the wider healthcare and education agendas and help to drive new issues such as interprofessional learning and collaboration. They need to promote diversity and innovation in leadership. So these are the challenges that we meet when you're working as a leader of the team. So what is the process for an effective leadership? First, priorities need to be set. Time has to be managed to integrate the work and personal life. Tools to stay organized and manage busy schedules. Effective delegation may be used to share the work of new projects. Organization to ensure an understanding of tasks, priorities, and deadlines. Establishes the steps and sequences to achieve a desired outcome. List the required resources. Communicate with team members and monitor the progress in activities and provide guidance to the team members. So how do we develop the leadership skills after talking about leadership for so long? So if you're not a leader by birth, nobody is a leader by birth for that matter. How can you develop your leadership skills? So now the formally leadership qualities development has been included as a part of curriculum. So now and then you will have lectures on that. Apart from that, you can also go for leadership training programs and workshops. You can read a lot about it and develop your skills. You also have, when you get opportunities for practicing a leadership, you tend to develop the quality more. Promotion of a professional network, accepting more opportunities. So most of us try to kind of escape when you're given an opportunity to be a leader. So that trend has to change a little bit. And also when you do mentorship for others. So to conclude, leadership quality is a mandatory competency, and you should understand that it is not related to an authority or title that you hold. It depends upon your individuality. So you have to rightly balance the accountability and autonomy in such situations when you're being a leader. It requires a leader to step forward, collaborate things, and also, most importantly, contribute to the teamwork. And for being a good leader, definitely you should have a clear and respectful communication, which is mandatory. So after talking a lot of theory about leadership, I thought I will give you an example in a clinical setting. I don't know how many of you have heard of code blue. The term code blue is a hospital emergency code. It's a mega code that is used to describe the critical status of a patient. So suddenly in an ICU or somewhere, if a patient collapses or goes in for a cardiac arrest, the hospital staff may call a particular number that is assigned by the hospital and activate this code blue. For example, if a patient has respiratory issues or if he is going in for a cardiac arrest, or when there is a medical emergency, you can activate the code blue. So in such cases, what happens? There is a team for Code Blue, but there's always only one leader. For example, in this picture, you can see that the team leader here, who is wearing the apron, is taking leadership. He's mostly the anesthetist or a physician in charge, and he always directs the activities of the code. So there are different other members of the team where there's a recorder and a timekeeper, a person who is going to do a CPR, and a person who's going to manage the airway, and somebody who's ready with the defibrillator to deliver the shock, and the other person who's going to give the medications. So in this situation, what does the leader do? He tries his best to control the chaos. So when you know that a patient is going to be really sick, there are not only medicos, his attendants are going to be around, other patients are going to be around. So you need to calm the situation. I mean, the leader has to calm the situation. Most important role of the leader is to assign the roles specifically. So each and every person in the team has to be given specific roles, and there should be always a closed loop communication. That is, if I say something, I have to know whether you have done it or not. So somebody to whom the instruction has been given will respond back saying, yes, it has been done, or no, it was not done. So they have to respond back. The message should be delivered very clearly. Constructive intervention here means you talk only when there is a need to talk. So all your messages should have a meaning. There should not be any unnecessary intervention. And also you should know your team very well, their advantages and also their roles, their skills, and what are the limitations so that you can assign the appropriate roles to them. Knowledge sharing. So whatever you're going to do, you have to share it with your team. Mutual respect is definitely important, whomever may be, she might be senior to you, junior to you, colleague, or anything. Mutual respect is very important part of the team. Reevaluation. So, monitoring what you have done already. So, once the event is over, you always have to summarize what has happened and also give feedback to each and every one of them about how they worked, collect the feedback from them about what they feel, and also the team members will sit and discuss about how to improve their work in the next similar situation. Finally, you need to thank everybody in the team as a leader and also encourage them to do better in the upcoming situations. So here I have a video for you where there's activation of code blue and a team works with one leader who will show all the qualities that we have been discussing so far. So here you know that the team members are discussing about what went wrong and how could we improve it next time. So here we know that the team has worked together and they are discussing about feedbacks of each of their roles. Thank you. So I think leadership qualities are very important and it's an action, not a position anymore. Thank you once again.